For this very important step, we then take towards fulfillment of the commitments we then make towards improving maternal and perinatal outcomes in the country. You know, commodities like drugs and medical consumables are things that were necessary what we use on a day-to-day basis for provide care to pregnant women and the other beneficiaries then. And the PCMH now a free healthcare facility, we rely so much on government support, you know, for make who get the necessary supplies and commodities they all require. For let the job go on well, for let the pregnant woman herself benefit from them and make who help for take care of them. So this is a very good thing, and that's something we appreciate deeply. It will make you work lighter, and not only that, it will also help the beneficiaries, the pregnant women, them, for make them go through the journey of pregnancy and come out, you know, very well and ensure a positive experience of the whole pregnancy journey. So a very good. We are happy today. We feel. I was so excited when I see, you know, the truck they enter the compound. You know, it's so much of a relief. And so much of, joy to me personally. And I believe the staff there of the PCMH as well appreciates this gesture so much, and we will promise that we will utilize their commodities there effectively, efficiently, for ensure that pregnant women them and the one that were deserving of this particular support benefit from them. You know, we'll try for minimize wastages, we'll try for use them prudently, because we know say now money and the finances involved for get these medicines there for which we. So we want to tell government plenty thank you and appreciate this support. So on behalf of myself and, you know, staff of the hospital, you know, we'll tell them plenty thank you for coming with this supply. And also thanks to Dr. Lawrence Sandy. They've been so energetic in, you know, getting us, you know, to move things and to make a change. And we appreciate this type of leadership and support, and we count on them so much. Thanks so much again once more. So we appreciate this gesture. Thank you.
On behalf of the Oladuring Children's Hospital, we want to say thank you for this wonderful thing we are going to do for you. We really appreciate that, because we're not going to be able to do the work if medicine all day. So really this medicine, this time what it can be really timely. And we promise say we will use them for the purpose where it is, and the beneficiaries that they will benefit from it. So I want to say thank you. But before I go conclude this, I go want at least we pharmacists then they are the head itself will say something. So I want to say thank you and we really appreciate that. And I want to tell the minister thank you for this step what it said. We really appreciate. Thank you.
Thank you very much.
Thank you very much, Rachel. Even though there are challenges, but we want to appreciate waiting government. There is a lot. The social need of the people high. The turnout, the turnover, they get the patient, the way they carry them back. So looking at saying quarter one we receive now, you know, January, February, March. Better late than never. We also appreciate, and we know say the procurement process gets a long time where it take. And then go and check and make sure say we get product the way of quality, and we not deal with things that we get very close expiry date. So with that time, I think say NMSA can do in best for ensure say then come with supply where we could use well. So far a lot they we need. What will the big Papa government for, and also the director where they are. Let me not say apart from this free healthcare supply where they come, there are also other things where they can ask for, where they can describe. For example, the cost recovery for the two hospital or doing a PCMH is non-functional. So we ask Papa government whether there be a policy say when a free healthcare facility, not forget free healthcare and cost recovery. Let me check. Because the cost recovery, access and availability to medicine is key. Why we are saying this? Because the government is doing best, and also we have other partners on ground. For example, for Oladuring, we have the Kapanamo. Kapanamo is also doing best to support where we have gap. All we want to save life. We want to say thank you to the director, and we want to say thank you to everybody, and particularly the caregivers that are coming to receive this medicine. We want them to use them for the actual purpose we make for. Because however we look at them, government don't they do this for over. I've been here from 2019. To date, we must receive the free healthcare commodity, and it is coming. So we want to say thank you to them. They want the way they put things together for let this happen. Let God continue to bless them. We self on ground where they do work. Let God make self do it with integrity and ensure say we manage this commodity well, so there will be transparency and accountability along the line. Because for now we have a mobile device to use, which is the M Supply mobile application. For every medicines we give to somebody, we must be accountable for it. So these medicines are not like free, or we don't give to everybody like healthcare worker. They are meant for the beneficiary. Children under 5, and as well as for PCMH, lactating mother, they are giving them. So what now as pharmacists for Oladuring, we want to say, but thank you to Papa government. Let us put more effort and let us support the free healthcare services. Thank you very much.
Thank you very much, Mr. Pharmacist. So at this point, we will listen to the managing director, Dr. Lawrence Sandy, to get statement from me. Then after, we will handle the symbolic handing over of the talk, where you will go open the talk, everybody for see. Over to you, sir.
All right, thank you. Good afternoon. I think all things don't be said, really, quite frankly. For me, now for just first off start by expressing the apologies on behalf of the leadership of the ministry. You know, the office of the minister and deputies, the technical lead, the CMO, and with PSA office. They normally can there in this symbolic handing over. For sure, say the ministry and government, you know, committed to this drive of enhancing the free healthcare initiative. They're not there today because when they talk, they didn't a meeting. As you all know, there's a brand new ultra-modern hospital. We don't go up now Lumley. So they sit down, they discuss with partners, they foresee how the hospital will be managed and sustained over the next couple of years. So that I'm meeting and deeper. So that some of the challenges what they see now, we're not going to see and repeat itself to that hospital. Because that hospital, therefore, be a specialized hospital. We're going to pick from the patient, they will reduce the patient burden now. So what's needed there is even more. So now that they make the data that meeting, and the total fit say, well, in their absence, I express my sincere apology, but also that we further out the program because we know say the hospital leadership now, both PCMH and Oladuring, they're competent enough for able to manage this. What do they do? We can normally call and say a symbolic handing over. For give confidence to the, you know, the people that want to work now. So the patient, the most important the way they can have for say government in commitment for continuing this free healthcare initiative is still there in place. Matter of fact, what's on that happened from 2018 to date. There has been significant improvement in the free healthcare initiative. Because the free healthcare initiative, it cover almost everything where categories of patients that are beneficiary need. We know the pregnant women, lactating mothers on the 5s. Then we don't have 2 more categories when are people with disability and then possible are survivors. So it's a big category. And when you look at that scheme, it not only cover people in a Western area or PCM or Oladuring, even though we know say probably the biggest beneficiaries they come from here. But it's not across country. So they talk about probably over 40 hospitals, different mix, tertiary, primary and secondary hospitals, over 1,400 PHUs across this country. So it's a big, huge daunting task. But government not making everything possible that every year from 2018, waiting meant for the free healthcare initiative in terms of drugs and medical supplies, they are made available. So we there today now for continue on that pathway. Because every quarter, we don't make sure say at least drug can, no matter how much it is, but at least let us symbolic drug can let it give confidence to the system. So now a continuation of that what they do today. When they see 1 truck here, but more trucks are on their way. But what's important, let me go emphasize this time around, because most times I can come when they talk about the supplies. What's important this time around is the management of the commodities. The challenges are there. I mean, I know I'll devolve into that. But the small way they give you, how you manage and how they give confidence to the system, now they bring in transparency and accountability by default. Now they be able to attract more funding into the scheme. What we don't see over the last couple of years is actually not a good picture. Because small supplies go come, before you know, they don't run out. How it gets managed, which units they benefit from, no accountability, no. This time around, we want to see that. And for augment with that, we don't bring in an inventory management tool where almost all facilities now, all the tertiary hospitals, I can say, get them. That inventory management tool for able to tell you waiting come, what you dispense, now which unit they dispense and how that feedback information they can. For we, now that's we get for rely on for the replenish. In other words, for the resupply. So we're not just take supply who we can sync and we count, but we want to see that data-driven, you know, approach. So that they tell you at any given time, if now PCMH, you said today, now 500 gloves, pairs of gloves we use. We want to see the evidence. How many patients they come with access that one day. So for we, that will be the emphasis. But on this quarterly supply, make you always say, it's not limited here. If we supply today, if tomorrow need a rise, the pharmacists, they know how for me treat. The matrons, the MSCs, we don't tell them. Reach out to we are like now midnight, say we don't run out of it. So we'll do everything possible for replenishing. So you know, they just stop on this symbolic, you know, one of quarterly supply will bring up. So we really want to make una take that note and at least let una know say, particularly the beneficiaries are there. This free healthcare initiative now for una. Now for owner, at any given time when I come now, supplies will be made available. But sometimes you also find for long understands it challenges the day. You know, so with that really, again, as I said, more trucks are on their way. I go and see if we will kindly know the process we can walk through for access the truck. Because I think the transparency they start. Know what's in the inside, see the accountability measures, and then we hand over the commodities there so that they will put them to use. Because I know say as we speak, MS Metro they get a lot of work for do right now. We'll not keep them too long. But we're happy for there, and on behalf of the ministry leadership, I really want to say thank you. So we already there. I mean, kudos to really the leadership of this facility. You've been the engine of this healthcare initiative, and I think even if the minister be there, it will dauntingly overexpress a sincere thanks and appreciation to him. And the beneficiaries also, when they show some semblance of understanding when they can forget their care. So once more, thank you very much again, and I think we will walk through the process for Lord do the symbolic handing over. Yeah? Thank you.
Mr. Sandy. So we go come closer for all can do the symbolic handing over. Or we can stay over there. We go let the MS come. Yeah. So then talk. Yeah, Abu Afise go talk after we don't do the handing over. Anyway. Yes, after. Okay, well say something, yeah?
If you're glad you talk later. Good afternoon to we all. My name is Mary Musa. I want to tell Una thank you and tell the government thank you for this kind of opportunity. I want to give it today. I want to tell Una all thank you for this opportunity. Now this center, we don't see the medicine there, we don't see waiting, we don't supply. And we have hope say the nurses them, then go administer the drugs them to we according to our want time. We very appreciate Una, we appreciate the government, we appreciate the workers them, we tell Una all thank you. The only thing we ask Papa government as we don't start up, make it continue. Because we boku with the Beloma, no one for born some 10 and day Beloma in the Ghana hospital for buy drugs, then go right time, but the drugs not in there, but you come outside. So you see, then you have supply, but the drugs they not give. We don't start for supply. We tell them thank you for that and then continue. We want let Papa government continue to keep up drugs them at the same time. So I bless you now. Thank you. Thank you.
So when you come to the symbolic handing over, then folks are not just a camp. They need a lot of logistical support for them in Canada. But for transparency and accountability, we make sure so when they don't know, we give them a seal. If this seal cut, then we don't go open them. It means they don't tamper on a road, they don't tamper on the truck on a road. So they call the pharmacist for like confirm the vehicle number and the seal. We are in we call the MS, we can cut the seal. But you have to look at properly. You have to make sure say waiting in at this paper, now in at this seal. If they're different, then which means they don't tamper with the truck along the way. So at the hand over to the pharmacist, go.
So the vehicle number is AMF 434, and the seal, the documents for sure say now the vehicle is it's written there AMF 434. And then the seal number 556178. It's sealed. And 9 then are the documents as well, 556178. So this corresponds to the vehicle, so it's correct. And
so the call the MS for open the
for do the same,
okay, yes.
And then open the truck.
So upon verification, we'll get the correct seal number we match with the vehicle number. So this is evidence say a cam untampered with, a cam reach the destination way for it. So I'll go ahead now and then cut the seal.
Be careful. Just open this one. If you open that one, just grab one box. Just one.
Box there.
Come on, sis. You go beyond, huh? Go beyond there. Go beyond there.
Okay, so yeah, these are just a symbolic handing over. I think MS, you go represent both PCMH and Oladuring as the case might. But you know, finally mention the self-camp. Mention the self-camp. So exactly. So on behalf of the leadership of the ministry, when I represent government on well-body business, on behalf of the management and team at NMSA, we will symbolically hand over this free healthcare water one supplies for PCM and Oladuring to the leadership of both hospitals. As we don't say, we will make sure that these commodities will be used for the intended purpose and be used judiciously. When we don't see that that's what they do, they just a courtesy reminder. And why ensure that we beneficiaries will benefit from this so that we all will have health outcomes at this country. So thank you very much. I hand over this to you.
Thank you. Thank you very much.
Yes. Yeah, thank you. But they was able to beneficiary, another beneficiary. Yes, another one.
Just can say thank you. Representation.
I think we can go collect. This will be better.
On behalf of PCMH and Oladuring, Papa government want to tell you thank you. We just hope and pray that this will go continue. Because the Bele woman and Boku, we are Papa government. As it all begin, they are continue. We tell you thank you. Minister, we tell you thank you. Yeah.
Thank you very much. Thank you. A lot of
beneficiary.
Thank you.
Yeah, you will get
survival rest. I tell you. I don't represent all.
I want to tell the government thank you for the medicine they don't have for me. Tell the government thank you for it they don't do for me. I tell them all thank you. Not separate out the medicine. Ever continue for bless you all.
Thank you very much. Thank you.
Salima to service. Thank you, sir.
All right, thank you. Thank you.
Sir, doctor does see you. Doctor does see you.
This Unity Broadcasting as doing live inside a Cottage Hospital. We are the Oladuring and the PCMH Hospital come together and they come currently for the free healthcare drugs. The first quarter of the free healthcare drug supply. We start this hospital today. We now trucks they get for camp. This is the first one we don't come. We get more trucks on the way for camp.
Okay.
last time, I will check on.
This time we need to broadcasting. No, those are the live. Let's see PCMH. Currently, we get a truckload of medical drugs. For the free healthcare drugs distribution, just the start now. The first quarter, just the start now. So we are the symbolic handing over of the drugs to the hospital. This will be for the government 2 or 5 trucks of the drugs. Just the camp. This is Unity Broadcasting as we live and direct. Currently, we get people with the patients in the hospital. They're happy. We get the doctors, then the veteran, other people are also there. We're very happy for these free healthcare drugs because it really helps the hospital and help treat patients there. Well, sadly, the belly woman and then that's it. on the one that we then get belly, and the picky that we then on that fight. See the truck. See the the hospital really late, right? And you see the this is a forget over 4 or 5 of them truck they really got this hospital all over. Other hospital they need, there's no this year the one whole country where every 3 months they distribute every 3 months this is the first one they start doing PCMH in the Cottage Hospital, the truck is the free reaction also. This one. It's YouTube broadcasting as we live and direct. It's the Oladuring Hospital. Oladuring Hospital. Also the Cottage Hospital. So Cottage Hospital. This is the happen also that the Cottage Hospital. Therefore happen the Wow Hospital at the country. This is the first symbolic handing over of distribution. They happen inside Oladuring Hospital. The Cottage Hospital. We get doctors in Naya, we also from the ministry, also they have part of the minister, because the minister is on meeting currently, as you say, they for open one of the biggest hospital and saloon along the way, on the arrangement, maybe next week or next month or this month, they are likely. This is Unity broadcasting as we live and direct. You can go off now.